Hi, my name is Ifan. I'm joined today by Francesca, Rory, Mariana, Sanun, and Zanandi as we present to you healthy aging in the context of climate change. Healthy aging, what is that? It's the idea of maintaining a strong physical, mental, and social health as we grow older. However, it's not that simple. Not only is aging often accompanied by symptoms such as chronic illness, mobility loss, as well as cognitive decline, climate change-related disasters such as heat waves, air pollution, and power outages can disproportionately affect older adults. Furthermore, certain inequalities can make it so that it's even harder for many older adults to stay healthy and safe. Our team suggests highlighting the benefits of low-traffic neighborhoods, such as safer, cleaner, and quieter streets, implementing the band-responsive transport to support those who struggle with fixed-route transit, as well as installing real-life environmental displays to show improvements in air quality and noise, building public support.
As you can see, there are many populations that will benefit from this scheme. When considering ageing, this solution takes a life course approach, creating education within the neighbourhood via the mosaic, cleaner air, and better social infrastructure. This scheme has equity at its heart, with demand responsive transport options available via an app and community hubs being available for people who prefer to call. The global framework that addresses our solution are the UN SDGs 3, 9, 10, 11, 13, and 17, the WHO's National Programme for Age-Friendly Cities and Communities, the Paris Agreement, specifically Mexico's pledge to reduce greenhouse gases by 22% by 2030. The Mosaic can be an adaptation of UN Compare and IQ Air, which uses citizen home air quality stations. Finally, reinitiating the 2021 free public transport trial in Monterey resulted in a 61% uptake.
In Monterrey, air pollution and rising heat aren't just environmental issues, they're public health threats. They increase the risk of asthma, heart disease, and cognitive decline. But most climate policies in Mexico still ignore the health impact. We need strategies that prevent illness before it starts. That's why we propose a dual approach. First, link health to urban planning through green infrastructure, risk mapping, and clean mobility. Second, act from the health system, train centros de salud or health centers to create low-tech education campaigns and install public mosaics with climate health tips. We also suggest bucking hubs so communities can easily access prevention services and workshops. Clean air must be a public health priority. Prevention isn't just medical, it's structural.
To evaluate the success of our proposed solution, we propose participation rates in community booking hubs and DRT services, reduction in hospital visits during heat events, increase in the number of older adults accessing essential services, improvement in self-reported readiness and well-being amongst older adults, percentage of older adults reporting increased sense of safety and security in their neighborhoods, reduction in the air pollution levels in areas with low traffic neighborhood, and traffic booking hubs in reducing air pollution and promoting a healthy environment for older adults.
Interdisciplinary collaboration is key to ensuring the needs of older persons are met. We propose establishing a small pilot with implementation and research oversight that includes the municipality of Monterrey and Tecnológico de Monterrey. This collaboration can facilitate implementation by coordinating between health systems, urban planners, governments, and communities. To implement this pilot, dedicated funding would need to be allocated to four functional domains. 1. Community consultation. 2. Public health education on climate-sensitive conditions. 3. Environmental risk data collection and mapping. And finally, data integration into health promotion and urban planning.
Demand responsive transport, or DRT, is heavily reliant on app-based booking systems, which excludes elderly populations, particularly within developing countries. In Mexico, only 34.7% of individuals over the age of 55 use the internet, and Russia et al. 2024 found that 62% cannot use a computer. Community-based booking systems improve access and inclusion, and will also play a crucial role during climate emergencies when digital systems may fail. Community-based booking systems ensure continued access to DRT, support vulnerable groups, and also build resilience in the face of climate emergencies.
Healthy aging is a social and economic imperative that is a net benefit to older persons in the wider community. As the municipality of Monterrey continues its established mission of facilitating sustainable urban planning, addressing air pollution can empower communities' health decision-making and promote the usage of non-motorized transportation. We are seeking mentors from the government, private, and civil sectors to facilitate meaningful community consultation, solution implementation, and maintenance. As we collaborate with the wider community, we hope to bring a breath of fresh air to older persons' daily life.